Kementerian Kekaya Kejela Kong Amprin Lengdo kala pentip Iing Dorbar bagi nongsong Shillong Pyniasoh ya ke Mhis ber Aadhar ke Duna bah Kejela. Ya kini kala pentip bah Jubab halor ke short duration discussion belawan ra du MLA nongpo bah Amir Bons Iing Iing Dorbar Tauan Kejela.
Honorable Deputy Speaker Sir, at the outset I would like to thank the Honorable Member from Nongpo Ba Meral Bons Iing for initiating an important short duration discussion on Pentrekam ka Reliance GI Company Limited ya ka contract Mhis but ka dbmnTv Meghalaya. I thank him particularly for having submitted an explanatory note so that we can focus only on a few issues raised by the Honourable Member. So coverage under RBSY for the insured beneficiaries in the initial years of the implementation of the scheme was restricted only to secondary care and surgical packages. The universal scheme introduced critical care, oncology and other essential tertiary care packages as well. So initially, when the scheme Rashtriya Swasthya Bima Yojana was initiated in 2009, coverages under the scheme was only up to 30,000 rupees per family to below poverty line individuals and their families for a nominal enrollment fee of rupees 30. Subsequently, sir, over the years, the insurance cover has increased to 2.5 lakhs in MHIS 2, 2.8 lakhs in MHIS 3, plus 30,000 senior citizen coverage for enrolled senior citizens, 5 lakhs in MHIS 4 and now 5.3 lakhs in MHIS 5 and 6. MHIS is now being implemented with the Pradhan Mantri Jan Arogya Yojana since the 4th phase, introducing several operational changes which has improved the service delivery of the scheme in the past 4 years. Essentially, in order to increase the number of beneficiaries at 4, MHIS 4 and PMJAY, the coverage is 6,92,979. And now, under the scheme, improvement is now being focused on database, which is key to the effective implementation of this scheme. So for this, a data analytical agency was engaged to refine the MHIS database during phase 2, and similar steps were carried out in phase 4 and phase 5. So additionally, the scheme moved from an enrollment-based scheme during phase 1 to phase 3 to an entitlement-based scheme in MHIS 4, which meant eligible beneficiaries were able to register themselves throughout the year. Over the years, sir, the number of people benefiting from the scheme has also increased. In terms of utilization by beneficiaries, a total number of 41,874 enrolled beneficiaries had benefited from the scheme, amounting to 16.6 crores under MHIS 1, which increased to a total of 79,042 beneficiaries in MHIS 2, with a claim amounting of 53.16 crores. In phase 3, a total number of 1,46,486 claims were registered, with a claim amount of over 94 crores. A major increase has also been observed now in MHIS 4. About 4 lakh 3,77,815 claims have been registered and more than 329 crores has been the claim amount settled to hospital. In MHIS 5, a total number of 1,77,679 claims were registered with a claim amount of rupees 140 crores. This is possible because of the constant improvements that have been brought about over the years. In terms of health benefit packages, after the implementation of the MHIS Phase 1, a costing collaborative scientific study was undertaken to define packages for Meghalaya, which was then utilized in MHIS Phase 2. MHIS is now in its 10th year of implementation, and Meghalaya has come a long way since being one of the only states to introduce the universal health insurance in the country. In 2021, the state conducted a health benefit package study which led to the introduction of revamping packages under key specialties like oncology and to increase in the rates of existing packages. Additionally, keeping in mind the state health policy, the scope under OPT diagnostic cover has also been expanded. Meghalaya is the only state in the country targeting OPD services under a government-sponsored health insurance scheme. After MHIS 4, accessibility to several hospitals has increased as many as 3,758 claims have been submitted by hospitals from outside the state, including Assam and states like Maharashtra, Gujarat, and others from 2019 onwards. The scheme's objective also includes improving the quality of healthcare. This can be achieved by strengthening the public hospitals, PHCs, CHCs, and district hospitals by improving and building their capacities. Over these years, many district hospitals, which are CHCs and PHCs, have also been able to earn revenue from the claims amount. This revenue has been utilized to upgrade and purchase medical equipment, purchase non-medical items like generators, and support medical officers in procuring medical consumables in case of shortfalls. Today, many facilities have used these funds to improve their service delivery at their respective facilities. In 2021, the national authority, which is the apex body implementing the Pradhan Jan Arogya Yojana, awarded the state of Meghalaya in 3 categories: top performing state amongst all states for gender utilization, state with the highest hospital rate amongst the smaller states, and award for Nagrams as a top performing public hospital amongst the smaller states. These recognitions are an attestation of the scheme's performance. Megha's Health Insurance Scheme Phase 6, Pradhan Mantri Jan Arogya Yojana, started on the 1st of September 2022. Transition to the scheme's next phase was made without any break and disruption, which allows beneficiaries to continue availing services under the scheme. Despite the change of Phase 5 to Phase 6, registered beneficiaries, households will not be required to register themselves again, therefore relieving the public from renewal of cards from one phase to the next. Such improvements in the scheme's implementation are what contribute to the success of the scheme. The Reliance General Insurance Company Limited is the current insurance company identified for implementing the scheme in Meghalaya for MHIS 6, selected through a rigorous and competitive bidding process. Some of the highlights of MHIS 6 and the PMJAY are an increased insurance to cover 5,30,000 per family per year inclusive of 30,000 OPD cover. No limits on family size, and scheme continues to cover pre-existing diseases. The number of health benefit packages is 2,253 packages and 2,665 procedures, which include OPD, daycare, OPD diagnostics, medical treatments, surgical procedures, and high-end drug packages. Existing PMJAY MHIS card holders will no longer to register themselves. However, eligible unregistered beneficiaries can undertake their registration process at designated centers. Beneficiaries can utilize the scheme at any empaneled hospital across the country. A mention was made by the Honourable Member on whether or not the Government of Meghalaya will be reviewing its scheme for reimbursement for the government officials. I would like to lay before this August House some of the thoughts and some of the plans that are underway on this matter. The government has adopted the Meghalaya Medical Attendance Rules, the MMA 2021, under the Department of Health and Family Welfare, providing government employees with a reimbursements-based scheme for availing medical treatment. The state currently has approximately 68,280 in-service employees and approximately 24,044 pensioners and all India service employees. Overall, approximately 4,43,155 members are getting medical reimbursements from different departments based on the MMA Rules 2021. Presently, the government of Meghalaya employees do not have cashless coverage for the medical services, despite the state of Meghalaya having universal health coverage for all citizens. In the present reimbursement process that is followed, claims from employees of various departments are submitted to the Directorate of Health Services, MI, in standard formats along with the supporting documents duly authorized by the heads of the concerned departments. These are reviewed and approved by the DHSMI and then sent for financial approval and then recommended for payment through the concerned department. One of the major challenges in this system is the arduous paper-based procedure and processes that is currently reviewed by a small team that comprises one doctor and 8 assistants responsible for assessing technical and non-technical documentation. Hence, human resources can be recognized as a challenge. This team is currently grappling with around 2,000 pending claims with extended hospital stay bills, causing further delays. Additionally, the option of medical advance necessitates accurate calculations to determine refunds for bills with a lesser final amount. Following the MMA rules, benefits are provided to the beneficiaries by utilizing the CGHS rates, which are not state-developed rates, and changes are dependent on the central government. Recognizing the challenges of the current system, to enhance the quality of healthcare services and ensure efficient utilization of public funds, the government is trying to access providing cashless access services within the existing MHIS framework for government employees. Drawing inspiration from the successful precedents in other states, integrating the employees scheme with the broader universal health scheme is a promising model. Using predefined healthcare packages and transparent rate structures can be instrumental in warranting financial viability. These well-defined health benefit packages offer clarity and facilitate consistent data management, fostering ongoing analysis and feedback loops. To realize this vision, it is to be noted that the successful implementation of MHIS over the past decade, the valuable knowledge that its challenges have presented to the state nodal agency has been a huge learning experience for the state nodal agency. The success process of identification and enrollment of beneficiaries, the empanelment of hospitals, and the proper management and settlement of claims and grievances over the years in both the public and the private sector. The state nodal agency Meghalaya, with proper coordination with the directorates of the department, can be considered as the nodal office to implement the Meghalaya Employee Health Scheme by converging into the MHIS framework. The scheme can extend comprehensive medical benefits to all government employees and their dependents by operating in cashless mode. This strategic approach is poised to streamline access to healthcare services and alleviate employees' financial burdens. In the implementation of this scheme, there has been issues of Aadhar linkage. And as we have seen from the data, total number of targeted families is 6,88,551. Total of numbers of families registered is only 4,93,975, which is approximately at 71.74%. Total number of cards created is 18,26,820. Total Aadhar card holders is about 24,77,241. Total Aadhar linkage with MHIS is 4,22,934, approximately only about 23.15%. Total cards created with MHIS in the last 2 months stands at 7,972. The Ministry of Health and Family Welfare, Government of India, made Aadhar linkage with MHIS mandatory in February 2023, and there has been very little decline in the scheme's usage in our state. However, to address the issue, the Office of the State Nodal Agency has initiated a vigorous awareness campaign across the entire state. Consequently, MHIS 5 has witnessed substantial growth and increase by the general public in compared to its earlier phases. The beneficiary identification system is an online portal for the registration of eligible beneficiaries under the scheme. Hospital and district kiosks have been set up throughout the state to facilitate the registration of beneficiaries under the scheme. However, as of today, there is no offline registration system. As I had said earlier, total number of cases registered inside the state is 1,95,731. Total amount submitted is 199 crores 83,30,265. Total number of cases registered outside the state, 2,335. Total amount submitted, 6 crores 29 lakhs 76,442. Sir, there is no requirement for a government doctor to refer to any procedure under the scheme for the general public. However, if this was to be dovetailed for the government servants, then we would have to amend the Meghalaya Medical Attendance Rules or the MMA rules. So as I have said, we are working hard to ensure that Aadhar linkage drives are initiated across the state to facilitate the registration of citizens towards availing this scheme. Sir, different districts have different models or modes of implementation such as camp mode, convergent modes, community modes and so on. So recently the Aapke Dwar Ayushman ADA drive, data entry operators of PHCs and CHCs are now being required to conduct weekly drives in villages to facilitate registration and Aadhar linkage to all beneficiaries. So we are also working hard on improvement of IEC and awareness programs. We're using the radio, we're using the print media, we are also using the online advertisements to ensure that this scheme goes wide in the state of Meghalaya. So I would like to specially mention that the MHIS also covers cancer treatment. Medical oncology has had 449 female patients registered, 735 male patients registered. In radiation, 67 females have registered, 102 males have registered. In surgical oncology, 12 females have registered and 10 males have registered. In cancer treatment alone, we have covered therefore 528 women, 847 men. With these few explanations, I hope that the Honourable Member and the House has been duly exposed and educated on our efforts towards the implementation of the MHIS 6 scheme in the state of Meghalaya. And with these submissions, Honourable Deputy Speaker, sir, I resume my seat.